Well, dealing with the pandemic pressure, many students here in Southern Nevada are struggling with the stress and the anxiety brought on by isolation and loneliness. And it's particularly hitting hard those families who don't speak English.
Yeah, it turns out that language barriers, they are making it harder in getting help with mental health. And 13 Action News reporter Astrid Mendez now shows you just how difficult it really is for local families to get help for their kids. Astrid.
Patricia, CCSD has more than 300,000 students while having only close to 160 psychologists. That is the reality right now. And when you add to this the language barrier that many families have here in our valley, it just makes it much harder to help with the students' mental health needs. Elizabeth Campo has been a Spanish teacher for 25 years at CCSD. Over the years, she's been the first contact for many students when they need help with their well-being. That's because there's not a lot of staff who is bilingual.
Student builds a relationship of trust with their teacher. And a lot of times that's where the mental health conversations come out. Or maybe a teacher observes a student who they know well, and that's where that conversation happens. When you introduce that third person who then has to communicate, that takes away from that trusted relationship.
Right now at CCSD, there's one psychologist for every 2,000 students. The National Association of School Psychologists recommends it should be one for every 500. The number of bilingual psychologists is much lower, making those teachers who can speak another language to fill the void. While there are some resources for families about mental health, finding them in their native language is very complicated.
If you go to this website, and you scroll all the way, you see right here that it's in Spanish. And if you click on this link, you see everything in English again. So how can anybody explain me how is this helpful for anyone? It's not.
Valeria Gore is the creator of CCSD Padres y Madres, a group she created when she saw the lack of information and resources in Spanish for CCSD families. She says that technology issues also complicate the access to those school resources since a lot of low-income and immigrant parents don't have internet or prefer in-person communication, especially with a delicate situation like their kids' mental health.
Parents couldn't even get through the phone because in many of the cases, the host or the receptionist, they don't have bilingual stuff. So imagine how difficult it is for them to access to support.
Gore says while parents need to know how to recognize possible mental health signs for depression and anxiety, CCSD needs to be better at addressing the non-English speaking families' concerns.
Let's provide the information to the families in the most culturally competent way, because the reality is that we still have at least another 4 to 5 months in the middle of the pandemic without a vaccine. So this is going to continue happening, and we should be preventing another child from taking their lives.
And CCSD right now has almost 40 psychologist vacancies. If you would like to learn more or know more about your kids' mental health, visit our website tonight, ktnv.com. Reporting live from CCSD headquarters, Astrid Mendez, 13 Action News.